Hi, I'm Chasten Freejay, and this is my presentation on personal protective equipment precautions. So, precautions can be separated into two categories: standard precautions and transmission-based precautions. The first is standard precautions. This should be used for all patients, and it includes the use of hand hygiene both before and after patient contact, and the use of gloves. This should be worn for all patients. Next is contact precautions. Contact precautions should be used for patients with known or suspected infections that are transmitted through contact, such as C. diff. For these patients, you will use hand hygiene before and after patient contact, and the use of gown and gloves. Next is droplet precautions. Droplet precautions should be used for patients with known or suspected infections that can be transmitted through respiratory droplets, such as through coughing or sneezing. With these patients, you will use hand hygiene before and after patient contact. You will also use gown, gloves, face mask, and if any splashing or close contact is expected, goggles or a face shield can also be worn. Next up is airborne precautions. Airborne precautions are used for patients with known or suspected infections that can be transmitted through the air, such as TB, measles, or chickenpox. For these patients, you will use hand hygiene both before and after patient contact. You will wear gown, gloves, and an N95 respirator. The last one is COVID precautions. For COVID precautions, these should be used with patients who have a known or suspected COVID-19 infection. You will use hand hygiene before and after patient contact, gown, gloves, N95, and goggles or face shield.